Hi everyone. So in this video today, I'm going to be talking about panic attacks. Panic attacks are a type of anxiety disorder, and panic attacks are the type of anxiety which comes on suddenly and disappears in a very short span of time as well. Of course, it may come back, but in a given period of time, panic attacks are the kind of anxiety which is just brought on suddenly, quite inexplicably, and sometimes without even any apparent cause, and stay like that for some minutes to at best an hour or so, and gradually resolve on its own. That is a classical definition of a panic attack, especially panic attack which happens due to an underlying mental health problem. Now, what does panic attack look like? So, during a panic attack, something that we have essentially seen in movies and shows, and something which we are very familiar with, primarily because of our understanding that panic attacks tend to mimic a heart attack, is that people may have sudden onset of palpitations, which basically means that they suddenly start feeling like their heart is pounding rather rapidly. And that is extremely frightening, extremely difficult to comprehend, especially in someone who doesn't have any underlying history of an illness pertaining to the heart. Outside of palpitations, people may suddenly have difficulty in breathing. So, a classical picture may very well be that they may be in the middle of a party where they don't even anticipate themselves to be having any sort of an anxiety, or there are possibly no preceding anxious or anxiety provoking thoughts in their heads. Everything seems to be going on hunky dory, and suddenly they start to feel like they are having rapid pounding in the chest where their heart is, and they may also start to feel like they're not being able to have deep breaths, almost like they are suffocated. And alongside, sometimes some people may also have the sudden urge to have to use the restroom, almost like they may have a sudden onset diarrhea. Now, the picture like that of diarrhea is not all that common. What is even more common is having a sensation of dry mouth. Sometimes people have an even more common feeling where it's called the feeling of doom, which means like they are absolutely convinced that they are going to die. So the combination of visceral, autonomic, and cognitive, which basically means the combination of all of these symptoms, as in cognitive symptoms, as in the thought process, the visceral symptoms, as in what is happening inside their body, inside their viscera, all of that culminates into them feeling like they're just about to die. And it is not some philosophical, distant kind of a feeling that they are going to die. It's a very, very medical, very, very imminent kind of a feeling, and very frightening kind of a feeling, and very sure kind of a feeling they are in fact going to die. So feeling of doom is a very important characteristic of panic attack. So like I said, that panic attack is something that can be brought down without really any explicable factor or any explicable circumstances, or without there being any preceding thoughts which could explain why the person is having this attack of anxiety. Um, it, however, tends to resolve in some time. It's not something that is going to carry on being there for hours and hours. So panic attack by definition is short lasting. That is a very important thing to be borne in mind. Now imagine someone who you do not expect to have any cardiac problem or a heart problem or any diagnosed heart problem or any diagnosed illness like asthma, bronchial asthma, or they do not have any other diagnosed illness like diabetes, because people with diabetes may also sometimes have panic attacks. And so obviously they are likely to rush sometimes to the hospital. So many people sometimes when they have panic attacks, they end up in accidents and emergencies, the casualties, the ERs, the emergency rooms. And that's primarily because they are convinced that there's something bad with their heart and that they are going to lose their life. So in a typical scenario like this, where someone has a panic attack, it is also important that they reach an emergency and not to assume that it is happening because of a mental health problem. And the reason for that is panic attack does in fact resemble a heart attack. So it is very important to first rule out that a heart attack might actually be taking place, which is why it is important to land up in an emergency room, in an accidents and emergency room, because that's where they are going to do a basic workup, a preliminary examination, an electrocardiogram, which is like a cardiac trace where they are going to find out if you are possibly having a heart attack. Now, outside of a heart attack, they are also going to see if there is a possibility that this may be the first attack of bronchial asthma. Very rarely, the first attack of bronchial asthma may sometimes appear like a panic attack. And that is because in bronchial asthma, the person is going to have difficulty in breathing, of course. But outside of difficulty in breathing, it may cause immense anxiety, especially when it is catching someone off guard. And so it is very difficult in that circumstance to discern and discriminate between the two entities as different, whether it's panic attack or is it bronchial asthma. The other common thing that one needs to be very aware of in case of a panic attack is a condition, diabetes. Now, why diabetes? Because people with diabetes take medications which are supposed to lower blood sugar levels, especially insulin. And sometimes, if somebody takes their insulin but forgets to follow it up with a meal, they may go into a state and forget to follow it up with a meal, they may go into a state where their blood sugar falls rather low. And a low blood sugar is going to activate the same systems in the body which are going to create symptoms and signs which are going to look exactly like panic attack. One of the other conditions that I like to talk about in cases of panic attack is that, especially in younger men, especially in men in their 20s and 30s, there is a condition which is not all that uncommon, and that condition is called pheochromocytoma. So pheochromocytoma is a condition where a young man would have had several episodes of hypertension, which basically means they do not have high blood pressure as such, but on occasions they would have had high blood pressures, which basically means that they would have a history along the lines where over the preceding 2 to 3 to 4 years they would have had to visit a doctor because they would have had blood pressure spikes, or they would have had episodes where they would have had sudden surge of aggression inside them, which would not have been in keeping with their usual personalities, or they would have had isolated incidents of panic attacks. So when you see an individual like that, a young man with isolated episodes of hypertension, isolated episodes of panic attacks, isolated episodes likely of aggression and anger control, in those scenarios, we have to be mindful that what we might be looking at might be a case of pheochromocytoma. So pheochromocytoma, in simple terms, is a tumor. Now, the word tumor makes it look very dangerous, but thankfully it's not a cancerous tumor. It's a tiny tumor which sits in a gland called the adrenal gland. Adrenal gland happens to be a gland which sits right above the kidneys, and sometimes the adrenal glands start to make lots of hormones, and when these hormones are being shot out into the blood at intermittent levels, the people may end up with bursts of hypertension, bursts of high blood pressure, bursts of aggression, and sudden isolated episodes of panic attacks. So when someone has a panic attack, we need to figure out if this is happening as actual heart attack or it's a panic attack. Is it the manifestation of bronchial asthma? Is it happening because of hypoglycemia? Or is it possibly because of a condition like pheochromocytoma? Also, in some people with phobias, for example, somebody who is autophobic, somebody who has fear of heights is quite likely to have panic attack. But that panic attack is going to happen only when they are exposed to things that they are fearful about. So if somebody who has autophobia has landed up in a situation where they are required to be at a height, they may have precipitation of panic attack. But the panic attack that I'm trying to speak about is a diagnosis that we make after ruling out any such above causes that I've highlighted. And that happens because of seemingly inexplicable causes. That happens because of seemingly inevident causes. That happens because of reasons which haven't yet formulated themselves into a theory. So it's largely considered what we in medical fraternity call as idiopathic, which means cause not known. What the causes are, we could get into that at a later stage, but yes, that is the basic picture of panic attack. And once somebody has panic attacks, they start to have what we call as anticipatory anxiety, which is quite understandable, because if somebody has found themselves in a state where they had feeling of doom, where they have felt like they were going to die, they are not going to make it, even though they may have visited the doctor, they may have they would have gone to the emergency, would have been reassured that their electrocardiogram, their ECG is fine, their heart's fine, and everything else is a-okay. But to be in a situation like that, it could be fearful and scary, and that's why it comes to associate itself with what we call as anticipatory anxiety, which means that people then start to remain in perennial fear that that attack is going to happen at any time. In fact, I've seen many such individuals where sadly one panic attack has then led to constriction of their life and its scope. And that reason for that is, if they have had panic attack, they start having fears. What if this were to happen when they were alone, or when they were not surrounded by anyone? So they start questioning their choices in life. They stop going on business trips because they don't want to end up in a situation where they're on their own. They want to be in a circumstance where they're always surrounded by someone. Gradually, they may start becoming phobic of places where there is a chance of being stuck on their own. And that is what is classically known as anticipatory anxiety. So, panic attacks, once they are diagnosed, you will almost always be referred to a psychiatrist for the management of panic attacks. And whilst there are medications, one of the important drives for me to start this channel has been to speak about other management options that psychiatry has to offer beyond medications. And I have my reasons for that, and in my future videos, I am going to be getting into those. I am going to be getting into those channels of discussion, as well as to why I wanted my channel to focus on things beyond medications in psychiatry. But I'm not going to dive into that digression just as yet in this video. So just for the scope of this video, let me clarify how panic attacks are managed. So of course, there are medications. There are several medications which can be tried for the management of panic attacks. But what is very important in the management of panic attack is, of course, therapy. Now, therapy is an often used term. There are many types of therapies, many types of therapists, and the various rationales of therapy. Having said that, one of the, like I said in the beginning, I must have said in one of my videos, not quite in the beginning of this video, that I have felt that as a psychiatrist, I wish to be talking about things which I feel haven't been said enough. And so without really making it overly complicated, but also not making it generic in that what can be offered for panic attacks, I do want to, in this channel and in this particular video, talk about certain things which can sometimes call panic attacks. So one of the things which I think needs to be talked about is that, you know, our mind has a subconscious domain to it and an unconscious domain to it. And where we store a lot of our memories, thoughts, conflicts, feelings, dreams, desires, aspirations, thoughts that we can't quite say openly in a society, or feelings that we are not being able to express for all sorts of reasons. But it never really truly leaves. It all really stays in there in our subconscious brains. And I'm sure you all would have read a little bit of psychology, where we know that these may find their way through dreams, find their way through things we end up speaking without quite realizing why we ended up speaking those things, or reacting a certain way when we weren't even expecting to say or react in a certain manner. Having said that, when such things, unsaid things or suppressed things, or things we wanted to give an outlet to, couldn't quite come out, and they had to stay somewhere in there, remain floating about, hanging in there, just lurking, they are not without effect, so to speak. And so oftentimes they say that some of the panic attacks, at least, may be a result of the unsaid thoughts, the unsaid fears, or the unsaid anxieties we may have about our lives and about future. The other thing that the panic attacks may emanate from are the conflicts that we may carry. And by conflicts, I mean that sometimes we really want to do something, but for any reason in our life, we feel that we have to be the adult one, we have to be the restrained, the reined in one. But the conflict between desire and the conflict between the desire that we actually want to do and the actual act that we are ending up doing, which happens to be a balanced act that we are trying to do and not quite going gung-ho in the direction of desire, that conflict sometimes actually can lead to the genesis of panic attacks. uh, and like I said, that it is all really housed in an intangible entity called the mind, and not just the mind, subconscious mind. It's not a physical entity that we can really access. It's an intangible entity which is like floating about somewhere and is, carrying these thoughts. And so, what therapy can and must do really at a very gradual pace, of course, therapy cannot be something that yields immediate results. And it is not, it is neither fair on therapy nor is it advantageous for anyone to expect fast track results out of therapy. Uh, it's a process that needs to be dived into gradually. I often say, when there is fever, it happens in a day or two. And so we expect it to come down in a few days. But something that has built over years and months of our lives, we need to treat it with due respect and really ease our way into it. That is therapy, rather than expecting like miraculous results, or just walking into therapy with the expectation that within second, third, or fourth session we are going to be able to touch on the conflict, the live wire that is lying there, which has led to this panic attack. But from my experience, I can certainly share that there have been cases where, with gradual work, we have been able to pinpoint on the possible conflicts. There's no way of knowing that we actually worked on the right things, or they were in fact the things which led to panic attacks. But by trial and error, by hypothesis formulation, gradually but slowly, we were able to formulate several possible conflicts that they may be harboring over a few years that may lead to the genesis of panic attacks. So these two things I really wanted to iterate in context of panic attacks, something that really needs to be talked about and highlights the importance of therapy in panic attacks. One being that the unexpressed thoughts, which essentially means that sometimes we go through our lives not quite really saying all that we want to say, not quite expressing all that we want to express. That could be for the want of time, for the want of the kind of friendships we want, for the want of comfort, for the want of fear of fracture in relationships, for all sorts of reasons. But like I said, all that is lying in there in some intangible entity like subconscious mind, is not just sitting there being inert. It is very much active, very much volatile stuff in there, and sometimes may just need a little bit of precipitation, a little bit of something going wrong in our lives to unleash the whole trauma in the form of panic attacks. So it is very important to understand that even if we do not have someone we can talk to on a regular basis, just the habit of diary writing or journal keeping, or just even if you do it on a phone, even if you do it on an app, if you like praying, if you like having just regular therapy sessions, if you have a guru, anybody, or if you have a very thick friend, a friend you're really thick with, not quite thick friend, but a friend you're thick with, um, any form of outlet, any form of channel for all those unsaid, unexpressed things, and any kind of space where you can really be your authentic self. For some people, meditation does it for them. For some people, it's praying. For some people, it's going to a temple or a church where they can be expressing their real self, even if it's in their own minds. But whatever it might be, as long as us humans have that outlet, that is definitely going to be even more helpful in the management of panic disorder or a panic attack. Second, of course, like I said, gradually aiming that in the work of therapy, you're able to come up with those possible conflicts that are residing somewhere in your subconscious mind that are possibly leading to genesis of panic attacks. Um, I have often seen two or three of my individual clients that I worked with in the past. I felt like just the fact that they started being more honest with themselves and expressing their fears to themselves. Because sometimes, you know, in the whole positivity culture and the whole hustle culture and the whole bid to really push ourselves, and there's nothing wrong with it, it has its own utility, but during that process, when we just start shoving things down and, you know, pushing things down and brushing them under the carpet, they accumulate over a long time, and that can't be healthy for us. And so I do recall 2 or 3 of my clients who, just with a lot of active diary writing and active journal keeping and an active effort on their part to just be honest with themselves, were they able to really gradually work on the resolution of panic attacks. And I don't want to give false hopes that it is going to be a short piece of work lasting few days or weeks. It really depends. There is no timeline as such. There are people who may have miraculous results within days, but there are people who may need more than that. They may need a year-long therapy or 2 years long therapy. So therapy is something that needs to be done with a lot of patience, a lot of genuineness, a lot of commitment, and also a sense of detachment without expecting any tangible results out of it. And I say this not so that you have that pressure on yourself or on the therapist. I say this because I think the element of pressure actually takes away from therapy. If you truly want to get maximally out of it, you need to walk in with a very open head. You have to walk in with a headspace which is not really seeking specific solutions, because it's like a garden where so much more can come out of. So why go in with the mindset of just plucking a certain kind of flower? And this is not I being philosophical or unnecessarily keeping it non-tangible. This is truly the gist of therapy, that one has to walk in thinking, oh well, we don't know, we're walking in what all we might come out with. There'll be some de-weeding, there will be some flowers we will walk away with, we will realize so many trees and plants that were in there and we didn't even know about. So it's a vast space, intangible but vast space, your own subconscious, and so it needs that kind of respect. But coming back to the topic at hand, in case of panic attacks, I can certainly assure you that if this therapy were to be done seriously by the client as well as the therapist, it can have miraculous results in the management of panic attacks. Um, the other things which I obviously talk about in my other videos is to do with the importance of physical activity as well. But I do want to highlight that if somebody does have panic attacks, we first need to be absolutely sure that that panic attack is not happening because of a problem in the body, like the ones I highlighted in the beginning of the video, like a heart attack or a hormonal problem or a bronchial asthma attack, or it's not happening because of an already diagnosed or already known psychiatric problem like phobias and fears. But once we're absolutely sure that those are not the reasons, and we're absolutely sure that this is a seemingly inexplicable panic attack, then in those circumstances, it is always a good idea and always advisable to work on your physical activity levels, to make sure that you have regular exercise, and to make sure that you sign up with a regular therapist to work on yourself, and hope that eventually at the end of it, you will be able to come up with the conflict that was possibly contributing to the genesis of panic attack. Of course, there are medications, and psychiatrists would always help you out with the kind of medications you could take. It is always important to remind yourself that whilst it comes along with the feeling of doom, and whilst you will almost, someone with panic attacks sometimes will reach a stage of doubt. Why are doctors not getting me? I do feel I'm going to die, and there's definitely something's wrong with me. I think this doctor is not good enough. They've not done all the investigations, so they often end up doing a lot of doctor shopping, sadly. And I can't blame them, because it's their body which is constantly giving them these signals that they're not going to survive this, that they're going to die. It's like their heart is pounding at such fast rate. Having said that, once somebody has told you that it is a panic attack, it is important to sort of constantly remind yourself that it is because of some unaddressed conflict in your head, or is it which is leading to some sort of an imbalance in your sympathetic and the parasympathetic system in the body. And so it is not that your heart is going awry, it's not that your heart's not working fine, it's just that your mental health needs far more uh, far more attention than it has It is difficult, it's easier said than done, but it is important to remind yourself that, because the added worry, the added fear, and the added anxiety of possibly harboring a cardiac illness which is not being picked up, which is not being diagnosed by any doctor, can only compound problems. Which is why, if all other possible causes have been ruled out and somebody has told you that it is in fact panic attack, an important aspect of managing it over the next few months is to constantly remind yourself that it is not your heart going awry, it is a mental health problem and needs appropriate intervention, which is therapy.